Wouldn't it be cool to have a helping hand in saving a life? Today I've decided to talk about my stethoscope and the importance it has to me in the nursing culture. The stethoscope is going to be an important part of any nurse's uniform. With this, we are able to listen to a patient's heart, lung sounds, and bowel sounds. And believe it or not, by doing so, we are able to detect any abnormal sounds that could potentially be life-threatening. And now I'm just going to demonstrate how to put these on, because most people put these on wrong. You actually go with it pointed towards your nose, and it goes in your ears. This part is a diaphragm, and this is a bell. And you just listen to skin when you're doing these. And the bells are used to detect bruits or abnormal heart sounds, which would be an S3 or an S4. And the reason it holds such importance to nurses and me is we decided to become a nurse because we wanted to help people. And in our assessment, without a stethoscope, we aren't able to hear on the inside. And most of the times, a disease process or what's going on isn't always on the outside, it's on the inside. And so by having a stethoscope, we're able to detect these problems early on in order to save a life. And some of the heart sounds that we can detect, a normal heart sound is the lub dub, and that's your S1 and your S2. And if they have abnormal, which can be an S3 or an S4, those are important to detect, because once we detect those, we can notify the doctor, and that patient may need a pacemaker in order to prevent their heart from stopping or to fire on cue how it should. In bowel sounds, we either have hyperactive or hypoactive. Detecting those is important because if we have a hypoactive, it actually can cause peristalsis, which is the bowel is no longer working like it should, and therefore the tissue is actually dying. And so that is a medical emergency. And then now lung sounds. You actually have a variety of lung sounds. You can have crackles, rhonchi, wheezing, stridor, and we need to detect those, and that deals with fluid. Now, if we're listening to their lung sounds and they have fluid buildup, it could be due to pneumonia, and if that's just sitting in there, and because we didn't assess them or we didn't have our stethoscope to listen, it could turn into atelectasis, and that is just a partial collapse of the lung. If you don't have a lung, you're not breathing, you're dead. And that's why having a stethoscope in the nursing culture is very important. It's not just part of our uniform to make us look like professional. We actually use those day in and day out. Every time we see our patient, we are assessing them. So, having a stethoscope, we do more, but having a stethoscope allows us to have a helping hand in saving a life. Not only do the patients depend on us, but doctors do too. We're their first line of defense when it comes to the patients. So, by having a stethoscope, we are able to do our job proficiently and help to save lives.